Today on Dr. Osborne Zone, we're going to be talking about a key nutrient that can lower blood pressure, lower blood sugar, improve blood flow, and guys, it can even improve your sperm quality and count. Stay tuned, we'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne Zone. Welcome to Dr. Osborne Zone. Today, it's all about CoQ10. Now, if you haven't heard of CoQ10, it's a very critical nutrient our bodies can produce. So it's not essential. We can make it, but as we age, we make less. And of course, there's so many different medications that people commonly take that can block it. We're going to be talking about those medications shortly. But first, let's dive into some of the primary functions of CoQ10. So as you can see here, one of its main functions is it helps your body make energy, converts hydrogen into energy. In essence, it helps your cells convert their food into energy. It acts as an antioxidant, which neutralizes free radicals, helping fight cancer and other inflammatory diseases. It can improve blood flow through enhancement of nitric oxide. It helps support healthy egg and sperm production in both men and women, supports cognitive health, as well as it provides immune support. So let's take a look at some images that might help you better understand some of the functions of CoQ10. This coming out of a paper published in the journal Antioxidants, but what we can see here are some of the multiple functions of CoQ10, and we'll blow the screen up so that you can see this more clearly. And as always, those of you who want these images, check the show notes. We always post a link below in the description for these images if you want to go back and backtrack them and pick them up. But you can see here CoQ10 is responsible for increasing ATP synthesis. This basically means it helps your cells make energy. ATP is energy. We also know it reduces ROS. ROS are reactive oxygen species. These are sometimes referred to as free radicals. These are the things, the chemicals that damage your cells and accelerate the aging and damaging process. We know that CoQ10 reduces oxidative stress. We know it's a regulator of the activity of the powerhouse of your cells, the mitochondria. And we also know it helps to stabilize calcium-dependent channels. And these calcium-dependent channels are present in your tissues like your muscle tissue and your nerve tissue and your brain. So very, very important calcium channels. We also know if you come over here, it's very important in the protection of kidneys through similar mechanisms, reduction of free radicals, as well as reduction of oxidative stress. We know it can reduce CRP. If you're not familiar with that, a lot of times you go to the doctor and they'll measure CRP in your blood. Anything typically higher than 3 is considered increased risk for inflammatory diseases. And so CoQ10 has an impact on regulating CRP levels. We know it does the same thing in your brain. It reduces free radicals, reduces oxidative stress. We know in your blood vessels, it reduces arterial stiffness. It also reduces the formation of plaques in your lining. That's atherosclerosis. We know it reduces insulin resistance, so it improves the way you use glucose. And so we also know it has an effect on blood lipids or blood cholesterol. So a lot of different functions for CoQ10 overall in multiple different organs. If we kind of back up and look at where it's probably most famously known for functioning, let's blow this up. It's right here in your mitochondria. So this is in the mitochondrial membrane, and you have these different complexes that you can see 1 through complex 4 and then complex 5 over here. But right in the center of these complexes is CoQ10. And so what CoQ10 does is it helps to distribute electrons. These are the negatively charged particles that help your body produce this substance here called ATP. And as I mentioned earlier, ATP is energy. It's what your body produces from the food that you eat. So when you eat carbs, fats, and proteins, you go through different chemical processes, break those things down. The end result is this high energy substance called ATP. but you cannot make ATP without CoQ10. So important to understand that. There's also some new functions that we're finding out about CoQ10. This was just recently published in the International Journal of Endocrinology, showing how CoQ10 helps to upregulate a very important metabolic regulator called NRF2 or NRF2. And so NRF2 activates or helps to activate antioxidant genes, detoxifying enzymes, as well as helps in transportation of different molecules. So all these things are functions of CoQ10 within your body and why it's so important of a nutrient to take into consideration. Now, if we look at symptoms of CoQ10 deficiency, some of the basic main ones. Remember I showed you earlier that the vast majority of CoQ10 is stored in your liver, in your muscle, in your brain, and in your heart tissue. And this is where we'll see symptoms showing up. We'll see things like chronic fatigue. This can occur as a result of brain fog and brain fatigue, but also in the muscles. We also have muscle soreness, muscle weakness. We could add to this list muscle cramping. So those of you that experience muscle cramping, you might consider CoQ10 as a potential possibility. And then swollen ankles is another common symptom. This happens as a result of a weakening or a reduction of the heart muscle strength. And so we'll get fluid retention in the ankles or edema. Very, very common cause. And this is one of the, so think of these as early onset symptoms. These happen typically long before severity of deficiency sets in, because severe CoQ10 deficiencies will lead to congestive heart failure and cardiomyopathy and severity of muscle pains and nerve damage and nerve pain. So these are some of the earlier onset symptoms that we see folks manifesting. Now, a couple of things here that I want to point out. And so one is this was a meta-analysis on research studies analyzing the effectiveness of CoQ10 supplementation for reducing fatigue. So again, one of the main symptoms of CoQ10 deficiency is fatigue. And you can see here CoQ10, a popular nutritional supplement, an antioxidant, and an essential component of mitochondrial electron transport chain. That's that picture I just showed you where CoQ10 was pivotal for ATP production. Several clinical studies have suggested that fatigue can be reduced by antioxidant supplementation. In this research review, they looked at 13 randomized controlled trials with a total of 1,126 participants. And what they found was a statistically significant reduction in fatigue scores amongst the patients who were taking CoQ10. There was only one adverse event in the 602 participants who underwent CoQ10 intervention, and that was gastrointestinal upset. So the key here is 602 people taking it showed improvements or reported improvements in energy. Only one of the 602 had some mild gastrointestinal symptoms. Based on the results of this meta-analysis, we conclude that CoQ10 is an effective and safe supplement for reducing fatigue symptoms. In my clinic, when people say, Dr. Osborne, I'm tired a lot, I just want to take something, can you just give me something that might help with my energy? CoQ10 is one of the first things I'll pull off the shelf because it's super safe and it can be super effective and from a side effect perspective, and again, it can improve energy. Now we get to this research paper here, effects of CoQ10 on statin-induced myopathy. I wanted to show this to you because a lot of people that are taking cholesterol medications, statin drugs like atorvastatin, rosuvastatin, Zocor, Lipitor, that class of drugs, if you've ever taken them or heard of them, are known inhibitors of CoQ10. So this class of medications we know can actually stop your body's ability from being able to produce its own CoQ10. You can see here 12 randomized controlled trials with a total of 575 patients enrolled. 294 patients were in the CoQ10 supplementation group and 281 were in the placebo group. Compared with placebo, CoQ10 supplementation ameliorated statin-associated muscle symptoms such as muscle pain, muscle weakness, and muscle cramping, as well as fatigue. So these are common side effects of taking this class of medication. Most researchers believe it's because the medicines deplete CoQ10, and that CoQ10, as we said over here, CoQ10 is very important. When it's low, can cause muscle weakness, muscle soreness, as well as fatigue and muscle cramping. And in this review, meta-analysis of randomized controlled trials, we saw that CoQ10 supplementation in those on statin medications had less of these types of symptoms. So bottom line, CoQ10 supplementation ameliorated statin-associated muscle symptoms, implying that CoQ10 supplementation may be a complementary approach to manage statin-induced myopathy. Myopathy just means muscle disease. Okay, so let's talk about some of the diseases linked to CoQ10 deficiency. There's several: high blood pressure, dementia, congestive heart failure, chronic fatigue, neuropathy, seizures, myopathy, and kidney disease. So if you have any of these diagnoses, think about that for a minute. If you've got a neuropathy, or if you've been told you have a muscle disease, this is commonly diagnosed when doctors measure something called CK. CK is creatine kinase. They measure that in your blood. If it's elevated, generally they'll diagnose you with something called myopathy. Kidney disease. So if your kidney function, GFR is the common marker on blood work for kidney disease. And if your GFR is less than 60, they're going to start classifying you in that kidney disease category. Seizure disorders like epilepsy, neuropathy. If you've ever had peripheral neuropathy, numbness, tingling of the hands, feet, toes, fingers, etc. Congestive heart failure. This is what I was talking about earlier with this ankle swelling. It's one of the first signs of congestive heart failure is your ankles start to swell. When the heart muscle gets too weak that it can't pump the blood and the fluid from the floor back up into the central aspect of your core of your body. And the chronic fatigue syndrome, remember, ATP equals energy. And you can't make ATP without CoQ10, and without that energy, you're going to live here in this chronic fatigued state. Dementia, this has to do with the antioxidant function and protection of CoQ10 on the brain, but also the energy production for brain cells. And so a lot of cases of dementia are being linked to CoQ10 deficiency, and then high blood pressure as well. So let's check out some of the human studies on CoQ10 and the benefits of supplementation. So in this particular study, you can see here, patients with moderate to severe heart failure were randomly assigned, this was a 2-year prospective trial, to either CoQ10, 100 milligrams 3 times a day, or placebo. So the dosing in this study was 300 milligrams a day. Now that's important because most of your over-the-counter supplements for CoQ10 are going to be 20 to 50 milligrams per capsule. And so when you're thinking about, should you take CoQ10 and how much CoQ10 you should take, again, this research study is measuring the effect of 300 milligrams of CoQ10 a day and on heart failure. And so in this study, there were 420 patients, human patients. You see conclusions. Long-term CoQ10 treatment of patients with chronic heart failure is safe. It improves symptoms and reduces major adverse cardiovascular events. So positive outcomes using CoQ10 as a treatment agent. I was once invited to a hospital system. This was probably over 15 years ago. And they wanted to do a research study, and what they were asking me to do was to donate my CoQ10 from my company. And so they wanted to do a study on CoQ10 and heart failure. And so I got to the table with all these cardiologists, and of course they were sharing the study parameters, and I read the parameters of the research study. And then my first question was, why did you design the study to fail? They had actually, on purpose, created a trial where they were trying to use 50 milligrams of CoQ10 per day. And of course, 50 milligrams won't do much for congestive heart failure. This particular study was to be done on congestive heart failure. And there was already pretty clear research even back then at the time that you needed at least 200 milligrams of CoQ10 to have any kind of impact on congestive heart failure. So what these doctors were trying to do was get me to donate my CoQ10 to a study that was designed on purpose to fail using only 50 milligrams. And so when I asked them, why did you design the study to fail? Why did you come in with such a low dose? They all got really embarrassed because they knew I had caught them in what they were actually trying to do, which was create a research study that showed that CoQ10 doesn't work. They were trying to show CoQ10 doesn't work, and they were going to publish this thing and most likely rely on ignorant folks in the media to report that CoQ10 was ineffective against congestive heart failure without understanding that the dose needs to be at least 200 milligrams a day in order to have any impact or effectiveness. So that's just a little anecdote for you on my experience with this. Now, let's blow this other one up. So this was a research paper done on peripheral nerve injury. And so you can see here studies showed that antioxidants such as CoQ10, a potent antioxidant, help the regeneration of peripheral nerve injuries. It has been observed to increase the myelinization process in nerve fibers and promote nerve regeneration, in this case, rats. There's a lot of research studies in animal models on peripheral nerve injury. And I have seen this in clinical practice with many, many people where we'll find patients will have either peripheral neuropathy or nerve injury, meaning maybe they had trauma or they had some type of chemical-induced trauma, and I'll get to that shortly. There are a lot of drugs that cause neuropathy, and that's what we would call chemical-induced trauma. So these individuals, at least in my own experience, are very frequently deficient in CoQ10 when we test their levels, and they respond typically very, very well to CoQ10 supplementation. But most of the trials of peripheral nerve regeneration occur in animals. I'm waiting for somebody to put together a nice trial in humans on peripheral nerve injury, but the animal research is very, very clear on that topic. Now we've also got, let's blow this one up, we've got research on, this is in humans, so treatment of essential hypertension with coenzyme Q10 or CoQ10, 109 patients with symptomatic essential hypertension. They were giving, on average, 225 milligrams a day. So again, the dosing, keep in mind, these are not 50 milligram doses. These are 4 times, 5 times, 6 times that 50 milligram mark, and this is per day. So in this case, an average dose of 225 milligrams a day. What they found was a definite and gradual improvement in functional status observed with the concomitant need to gradually decrease antihypertensive drug therapy within the first 1 to 6 months. Thereafter, clinical status and cardiovascular drug requirements stabilized. So over a period of several months, what they found was the need to gradually lower people's blood pressure medications because CoQ10 was effective at lowering their blood pressure. You can see here 51% of patients came completely off of between 1 and 3 antihypertensive drugs at an average of 4.4 months after starting CoQ10, this 225 milligrams a day. So takeaway here for you, if you've got high blood pressure and you're going to use CoQ10 to potentially impact your blood pressure in a positive way, and you're also taking drugs to lower your blood pressure, you need to be upwards of 200 milligrams a day, and it needs to be over long periods of time. You're not going to lower the blood pressure in 1 week. You're not going to lower it in 2 weeks. It took an average of 4.5 months to get these results. So keep that in mind. CoQ10 is a slow burn. It's not a rapid turnaround when it comes to taking it. Now here's another paper on essential hypertension and CoQ10. Let's blow this up. 26 patients with essential arterial hypertension were treated with oral CoQ10, in this case, 50 milligrams twice daily. So this dose was less than half of the other dose. So the other one was 225. This one's 100 milligrams a day. And look what they found in this study. At the end of the treatment, so this is 10 weeks, into the treatment, systolic blood pressure, that's the top number, systolic is the top number when you're taking your blood pressure, decreased from 164.5, okay, to 146 0.7. So we're talking almost 20 points, about, not exactly, but about 18 points of reduction on the top number. And when we look at the diastolic blood pressure, that's the bottom number, decreased from 98.1 down to 86.1. So that's 12 points. So if systolic was 18, diastolic was 12-point reduction. I mean, that's pretty impressive for a nutrient. That's pretty impressive for something that your body needs anyway, that has virtually a low to no side effect profile, and has the potential to help people get off of their blood pressure medications. So, number of trials in blood pressure reduction using CoQ10. Here's another really good one I want to talk about here let's blow this one up. CoQ10 improves blood pressure and glycemic control. So you see here, this study performed at University of Western Australia, Department of Medicine. The main effect of CoQ10 was to significantly decrease systolic and diastolic blood pressure, as well as hemoglobin A1C. So in this trial, or in this study, they had both lowering of blood pressure, both numbers, as well as a hemoglobin A1C, which is a marker for average blood sugar over time. These results show that CoQ10 supplementation may improve blood pressure and long-term glycemic control in subjects with type 2 diabetes. Profound, because how many of your doctors are recommending CoQ10? Typically the scenario is doctors don't recommend CoQ10. What they do is they recommend blood pressure drugs and diabetic drugs, which we're going to talk about in just a minute. I'm going to show you how those drugs can actually increase your CoQ10 deficiency. And this next one is an overview of a number of different research studies. And guys, pay particular attention, ladies too, especially if you're trying to have children and you're struggling at this. What they found with CoQ10 research studies is, and there's several of them listed here, you can see dosing of CoQ10, 300 milligrams a day for 26 weeks, improved sperm morphology, density, and motility. So the morphology is the shape. So if sperm is abnormally shaped, it won't swim as well. It won't make the journey quite as well. So CoQ10 improves sperm shape, as well as their speed of swimming, their motility, their ability to swim. In this other study here, 200 milligrams a day. So this was 300, this one was 200 milligrams a day, specifically giving ubiquinol. Ubiquinol is the better form of CoQ10, and we'll talk about some of that here in just a minute, but improves sperm density, motility, and morphology. So same outcome, same parameters at a lower dose using a different kind of CoQ10. You can see in this next study, 200 milligrams a day for 6 months, improved sperm parameters. You see down here, CoQ10, 20 milligrams of CoQ10 3 times a day, plus 10 milliliters of L-carnitine 3 times a day for 3 months. So this was 60 milligrams of CoQ10. Predominantly improves semen parameters and improved clinical pregnancy outcomes. And then we have this next study, 200 milligrams of CoQ10 a day with selenium, improved sperm concentration, motility, improved antioxidant status with CoQ10 treatment. And this next one, 30 milligrams a day of CoQ10 plus 300 milligrams of vitamin E for 3 months, improved sperm concentration and motility. And then down here, they gave a multi-nutrient supplement, or a multi-component supplement, CoQ10 being one of the primary ingredients, improved sperm concentration, motility, and improved pregnancy rates. So CoQ10 is no joke, guys, when it comes to enhancing the quality, the density, the quantity, and the ability of your sperm, their shape, and the ability of them to swim and make the journey. CoQ10 improves all of those things. Okay, let's talk about causes of CoQ10 deficiency. What might contribute to your levels being low? Now, I showed you a research study earlier on statin medications. These are the drugs that lower cholesterol. And so if you're on a statin, just know your CoQ10 is being blocked. It's being depleted. And we'll talk more about that here in a minute. Aging. There are a number of genetic mutations that can occur. Remember, your body can make its own CoQ10, but if you have certain genetic mutations, that process can be blocked and you can develop. These genetic mutations typically is shown early in life, not later in life. So we don't see the elderly developing major CoQ10 deficiency as a result of genetic mutations. This is usually found in childhood. We got other chronic diseases, especially chronic diseases where people have multiple medications, what we would call polypharmacy, where you're on more than one medication. Many of these drugs actually block or inhibit CoQ10's effectiveness or function. Oxidative stress. So if you've got behaviors of oxidative stress, what would that be? That would be poor diet, which we talk about up here, but it would also be processed foods are highly oxidative. Seed oils, smoking causes oxidative stress, alcohol consumption. So all these lifestyle variable factors that increase oxidative stress, air pollution, quality of your air, quality of your water, those types of things can all contribute to deterioration of your body's capacity to make CoQ10, but also increase the demand for CoQ10, and therefore your body uses more of it up in the process of trying to protect you. Mitochondrial disorders, as well as increased metabolic demand. Now let's check out, this is the CoQ10 pathway, and if we could blow this one up so that you can see it a little bit better, what we're looking at is the metabolic pathway by which your body is capable of producing CoQ10. And a lot of this looks like Greek if you didn't take biochemistry in college. And so I'm not going to focus too much on that, but I'm going to call a couple of sections here out. So there's a molecule that we make called acetyl-CoA. Acetyl-CoA is a byproduct of breaking down our food into energy. And we make this substance called acetyl-CoA, which serves as one of the essential building blocks to the pathway of making CoQ10. So you follow these arrows all the way down, and you come down here, this is CoQ10. And so we've got to start with base ingredients. And one of them is acetyl-CoA. Another base ingredient I'm going to circle over here is tyrosine. Now let's just draw a few things out. We can't make acetyl-CoA without vitamin B1 and magnesium. The acetyl aspect requires B1 and magnesium. This CoA aspect requires vitamin B5. And so if you have B1, B5, or magnesium deficiency, it's going to be harder for your body to produce acetyl-CoA, which is a raw ingredient that goes into producing CoQ10. So these deficiencies can contribute to lowering of your body's ability to make CoQ10. Tyrosine, the same thing. Tyrosine is an amino acid, and it comes from protein. You get most tyrosine in your diet from animal protein specifically. You know, we have this big war on animal protein right now. In the European Union as well as in the U.S., everybody, all the nutritionists and the governmental entities are saying animal protein will kill you and it will kill the planet and you should avoid it and don't eat it. And what really, in effect, you're going to do in part is you're going to create tyrosine deficiencies that deplete your ability to make CoQ10. But beyond that, animal protein is also a food source of CoQ10. Remember, you can eat CoQ10 in its form in food, and we'll talk about food sources of CoQ10 here in just a minute, but predominantly it's animal meat is where it's at, and you also need that animal meat to have tyrosine. So if you don't have adequate tyrosine coming into your diet, you're also going to potentially have a blockage in your body's ability to produce CoQ10. Now, in this pathway, you also require vitamin B6. So you notice that B vitamins play a pretty critical role in your ability to make CoQ10, B1, B5, B6, as well as magnesium and tyrosine. So if you understand that and you're eating those foods that contain those nutrients, great. You might also consider checking out some of my crash courses on these nutrients. I've got crash courses on each one that you can check out, but it's important that you understand how CoQ10 is produced if you're going to understand how we can develop deficiency. Now let's talk about medications that deplete CoQ10. And so this is a list of some of those drugs. As we've mentioned this one a couple of times, statin medications, definitely probably the most well-known and the most well-researched class of medicines that we know can block CoQ10. But a lot of you are on blood pressure medicine. Now, what did we just say a minute ago? We said that CoQ10 supplementation has the ability to reduce blood pressure. Okay, now, what I just showed you is that blood pressure medicines reduce CoQ10. And you see the connection here. If you're taking medicine to lower your blood pressure that reduces a nutrient that can also lower your blood pressure, you're fighting yourself. So many people are not just on blood pressure meds, they're also on cholesterol meds. And you know, the trifecta of cardiometabolic syndrome or metabolic syndrome is those people are generally on blood pressure meds, they're on cholesterol meds, and then they're on blood sugar medication. And so all three classes of these types of medications can reduce diabetic medications, blood pressure medications, cholesterol medications, can reduce or deplete CoQ10. So bad move, because at the end of the day, if you're depending on these drugs to fix you and you're causing this deficiency, that deficiency is going to lead to worse blood sugar. It's going to lead to higher blood pressure. So it's going to create the very diseases that you're trying to treat and prevent. We also know that antidepressant medications can deplete CoQ10. We know that antacids can deplete CoQ10 as well. So if you're taking drugs that block stomach acid, and we know blood thinners. So if you're on any of these types of medications, you need to talk to your doctor about whether or not CoQ10 is right for you. Wink, wink. Additionally, there's one other I want to add to this list, and that's estrogen. If you're taking, and this ladies, if you're on birth control, so birth control pills, and that's, you know, most of the time we see women on birth control pills is because they're younger and either they've got abnormal cycles or they're younger and they're just, you know, trying to not get pregnant. But then we also see women taking the bioidentical, the bioestrogens for things like menopause problems. And so if you're it doesn't matter which one, we know that higher doses of estrogen will reduce CoQ10. And this has been shown in research studies. So again, if you're on them, I'm not trying to tell you to get off your medicines here. What I'm trying to tell you is if you're on any of these drugs, you need to maybe consider CoQ10 supplementation to offset the side effect of what that drug can do to your CoQ10 levels. Because CoQ10 deficiency is no joke. It will really have a major impact on your overall health. So let's look at some studies on this. Again, all these studies are available in the show notes. If you want to go learn more, I encourage it. As you can see here, let's blow this up. Atorvastatin, 80 milligrams a day for 14 days and for 30 days. This study, the conclusion, even brief exposure to atorvastatin causes a marked decrease in blood CoQ10 concentration. Widespread inhibition of CoQ10 synthesis could explain the most commonly reported adverse effects of statins, especially exercise intolerance, myalgia, which is muscle pain, and myoglobinuria. This is where myoglobin, a protein, is coming out or spilling out in your urine. That was published in the Archives of Neurology. Now I want to show you another. So let's blow this up. I want to show you again the pathway of CoQ10 so that you can see how statins affect it. So you can see that chemical we were referring to as acetyl-CoA earlier converts into HMG-CoA. And then there's a special enzyme called HMG-CoA reductase. And this is where statins work. Statins block that enzyme. So you get stuck right here. And so that means you can't get to here. And that's cholesterol, right? That's the purpose of a statin, is to block the production of cholesterol. But if we look here, before you get to cholesterol, you see I've got it highlighted right here, ubiquinone. That's CoQ10. It's just a fancy way of saying it. And so now, when you take the statin to block that conversion, you also stop the ability for your body to properly produce ubiquinone or CoQ10. So you you interfere here, but look further downstream. You also interfere with cholesterol. Now, cholesterol is essential for the production of vitamin D. You can't make vitamin D without cholesterol. There's a type of cholesterol in your skin that converts to vitamin D when the sunlight hits your skin, when UV light hits it. But you also need cholesterol to make bile acids. You need it to make sex steroid hormones. So let's take this out a little bit further. What are the steroid hormones here that we're talking about? Estrogen, testosterone, progesterone are your main ones. Bile acids, what do? What is their job? Bile acids' primary role is they improve and increase the absorption of fat. Well, what's fat? Well, it's fat. Omega-3 is a fat. Omega-3 is essential fatty acids that help regulate inflammation and have impact with cardiovascular disease. But vitamins A, D, E, and K are all fats. So when you block bile acids and the production of bile acids, you inhibit the body's ability to efficiently absorb these fat-soluble compounds. But guess what else is fat-soluble? CoQ10. So now we go back to this, not only taking statins block your body's ability to make its own CoQ10, but through the action of reduction in bile acids, they block your ability to absorb the CoQ10 from the very food that you're trying to eat. So it's kind of a double whammy when you look at it. Now, on top of that, you've got vitamin D interference, plus you've got hormonal interference. Estrogen, progesterone, and testosterone are all reduced potentially as a result of taking statins long term. Well, look at our population. How many people are taking statin drugs? How many people are scared to death of cholesterol? And then so their doctor puts them on a statin drug, and then over enough time, statins are blocking CoQ10. CoQ10 deficiency does what? It increases the risk of heart failure, increases blood pressure, increases blood sugar. It lowers energy. It can cause neuropathy. It can cause muscle pain. It can reduce muscle or reduce the vascular flexibility of your blood vessels, leading to atherosclerosis. It causes the production of free radicals, so now you're not as equipped at protecting yourself from free radical damage. It's a bad deal, especially when we're talking about trying to reverse or reduce a chronic inflammatory disease. Now, here's the real kicker. I want to show you this next study that's going to kind of tie it all together. Increased risk of diabetes with statin treatment is associated with impaired insulin sensitivity and insulin secretion. This is a 6-year follow-up study. 8,749, so 8,749 non-diabetic participants aged 45 to 73 years were followed up for almost 6 years. The participants on statin treatment, so of these 8,700 or so patients, 2,142 were on statins, had a 46% increased risk of type 2 diabetes, and it was directly dose-dependent on simvastatin and atorvastatin, again, 2 of the drugs. So in essence, the more of it you took, the greater your risk for developing type 2 diabetes. Well, wait a second. I thought the purpose of statin drugs was to reduce your incidence of heart disease risk. Well, now we're seeing that it increases your risk of developing diabetes. Well, does diabetes have anything to do with heart disease? Does it have anything at all to do with the risk of heart disease? And the answer is obviously yes. It's a major risk factor for heart disease. So you're getting rid of cholesterol at the cost of diabetes, but also at the cost of CoQ10 and at the cost of absorbing fat-soluble vitamins and nutrients that play a major role in inflammation and play a major role in your risk of developing heart disease. So how effective really are these statin medications? See here, conclusion, statin treatment increased the risk of type 2 diabetes by 46%, attributable to decreases, and they found the mechanism, it's decreased insulin sensitivity and insulin secretion. So that by being on the statin, your insulin didn't work as well and your ability to secrete insulin was reduced, hence increasing the development or the risk for the development of diabetes. More on statins. 12 weeks of treatment with simvastatin and pravastatin lowered plasma CoQ10 levels by 50 and 54% respectively. Just cut your levels right in half after only 12 weeks. And then here, I showed you this study earlier, but I think we'll reemphasize it right here, is effects of CoQ10 on statin-induced myopathy. This was 12 randomized controlled trials with 575 patients. And what did they find? That when they took patients who were on statins and also gave them CoQ10, they were able to reduce their muscle weakness, their muscle cramp, their muscle tiredness, and their muscle pain. So how many of you have taken a statin? Just raise your hand in the room, in the chat box, if you've taken a statin and your doctor has told you any of these things. Because if they haven't, that's a problem for you, right? It's what we call informed consent. Informed consent means that when you get put on a medicine or any kind of medical treatment, your doctor explains the risks versus the benefits. So if the doctor says, if you don't take this statin, your risks are increased heart disease. And that's usually where this conversation ends. If you don't take the statin, you're going to have a heart attack. Right? But that's the risk they're trying to prevent. But they don't tell you about the risk of what happens if you take the statin. If you take the statin, the risk is it's going to hammer your CoQ10. And that the risk of CoQ10 deficiency is myopathy, myalgia, neuropathy, heart disease, high blood pressure. You see what I'm saying? We're trading all of what they're calling a benefit for all these additional risks. And so you should always have informed consent when you're trying to take a medication. But the vast majority of people don't know this, because if doctors actually sat down and explained it, I would venture to say most people would decline the use of statin medications, especially in light of some of the newer studies coming out that show that statins don't work for long-term risk reduction of heart disease. When we look at people who actually have the longest lifespan, it's the people that have the highest level of cholesterol. And when you couple that with the fact that the cholesterol that's being targeted is bad cholesterol, LDL is one of the molecules that carries CoQ10 and delivers it to your tissue. This is another mechanism of how taking these medications that lower your LDL will deplete your CoQ10. So not only do they deplete your body's ability to make it, they deplete your body's ability to absorb it, but they also deplete the type of cholesterol that helps your body distribute CoQ10 to your heart, to your brain, to your muscles, to your nerves, and to your other tissues. We also know that bad LDL, I say bad LDL, that's what they call bad. Bad LDL won a Nobel Prize. This was a number of years ago, won a Nobel Prize in medicine. Why did bad cholesterol win a Nobel Prize? Because it was discovered by some really great researchers that you need LDL to form nerve synapses. And if you don't have enough, when you don't form nerve synapses, what we end up getting is cognitive decline. Now, if you look back at the history of the use of statin medications, along with many of these others, again, it's not just statins, but I'm picking on statins today. It's blood pressure medicine, it's diabetic medication like metformin, it's antidepressants, antacids, and blood thinners. All of them deplete CoQ10. Most people with metabolic syndrome are on 3 or more of those different types of medications. And if you look at the onset of the use of all these medications, in the name of reducing the risk of heart disease, but look at the rate of cognitive decline or Alzheimer's disease. It's skyrocketing. It's skyrocketing. And could it be skyrocketing potentially because of this? Because of all these mechanisms? And I would venture to say a smart person would put their money on yes. This probably is in a large part what's happening. Now, certainly there are other variable factors, but I don't think we should dismiss these. All right, next let's talk about statins and the risk of polyneuropathy. In this particular study, long-term exposure to statins substantially increased the risk of polyneuropathy. Now, we've just said that statins reduce CoQ10, and we said that CoQ10, when it's low, increases blood sugar, and blood pressure. Okay, and what's one of the side effects of blood sugar elevation? What do they call that as a disease? They call it diabetes. And what happens to diabetics over time? Does they develop neuropathy? It's what they call a diabetic neuropathy, right? So could part of the diabetic neuropathy or the polyneuropathy induced by statins be from CoQ10 deficiency? Sure, it could be, among other things. And so this, again, is one of the long-term risks that you should have been told about before you ever put that statin in your body or in your mouth. So the drug side effects, many, many common medications deplete CoQ10. And if you're using those medications, you should very seriously consider using CoQ10 so that you don't end up in a heap of trouble from the deficiency of this particular nutrient. Now, let's look at some food sources of CoQ10. And I've got some of the biggest bang for the buck. It's pretty much in order: beef, poultry, fish, pistachios, cauliflower, and broccoli. But liver tissue, liver is not on this list, but beef liver, chicken liver is very, very high source of CoQ10. It's one of the best sources of CoQ10. So is heart. So I know a lot of you don't eat organ meat. It's just not something that is palatable for a lot of folks. But if you do and you like it, and you want to consider it, liver and heart tissue contain some of the best CoQ10 amounts of all the foods that we could eat. So I would strongly encourage you, if you like those foods, to give them a shot. Some people are now getting organ meats mixed into like their ground beef. And so they buy like an 80-20 blend where there's some ground beef plus some heart plus some liver ground in it. And that's another way to get it and bypass the potential, the potential negative texture effects, or some people are just sicked out by organ meat. What are some of the benefits of CoQ10 supplementation? So now that you know a little bit more about it, this should just make better sense for you, right? So supports cardiovascular health and function, supports immune and nervous system function, impedes diabetic complications, as we've talked about, neuropathy, guards against cancer by protecting from free radical damage. It reduces normal signs of aging, helps with gum disease and periodontal disease, assists muscle regeneration, slows the progression of mitochondrial disorders and neurodegenerative diseases. There have been a number of trials showing that to be true. So a number of studies showing that to be true. So there's a lot of potential upside for CoQ10 supplementation. And as I mentioned before, there are very little to no side effects of taking CoQ10, even at higher doses. So the question is, should you supplement? I think any of you taking any of the medications that we talked about today should definitely consider supplementation. Now, if you're going to supplement, you should know a few things. One is look for this. Look for ubiquinol. And there's ubiquinone, which is another form of CoQ10, and it's not as readily absorbable. And so it's important that you look for ubiquinol if you're trying to get the best CoQ10 that will absorb the best and have an impact on your blood and on your tissue status of CoQ10. It's also important to understand if you've had your gallbladder removed. So if you've had gallbladder surgery, you're not going to absorb. It's going to reduce your absorption of CoQ10 and other fats as well. And so you might consider, especially if you're going to spend the money, because ubiquinol's not inexpensive. It's one of the more expensive supplements on the market. You might want to consider using something to support your bile. And so taking an actual bile supplement before eating fat or supplementing with CoQ10 or other fat-soluble vitamins is going to potentially help your body's ability to absorb those supplements better. So if you don't have a gallbladder, if you've been told you have fatty liver disease and your gallbladder is not working properly, maybe you still have it in you. This is just something also to consider. If you've got celiac or inflammatory bowel disease and your poop is clay or tan colored, that's an indicator that you're not absorbing fat properly. And so you probably have fat malabsorption. You might also look at digestive enzymes or bile supplements to aid in that process if you're going to take ubiquinol, because otherwise what you take supplementally may not be absorbed as efficiently or very well, And of course, because it is such an inexpensive supplement, you want to be aware of that. Now, a lot of the questions I get around supplementation, is it safe? Is there a contraindication? Should I or should I not take it? And here's what we know. There are no known contraindications for CoQ10. None. Its treatment was found to be safe since side effects are rare. Gastric discomfort was reported in less than 1% of patients and had an excellent safety record. Studies have identified CoQ10 as well tolerated and safe in humans, even at higher doses. No side effects are seen, even in persons having CoQ10 dosages. Look at this dose, 3,600 milligrams per day. Now, we've been talking about studies where they're doing 200 to 300 milligrams a day. And what they're saying here is 3,600 milligrams a day, no side effects, and in super high doses. So is it safe? Sure, it's safe. How many people are going to take 3,600 milligrams of CoQ10 a day? Almost no one, because it's cost prohibitive. To take that much a day, you'd be spending thousands and thousands of dollars a month just to get to that level if you're trying to take CoQ10 at that dose on a daily basis. So it would be cost prohibitive for most of you. Most of you, 200 to 300 milligrams a day is a pretty good therapeutic dose. We sometimes put people on as high as 600 milligrams a day clinically in my practice, but as a general rule of thumb, these doses have been shown to be pretty darn effective for a lot of situations. So safe to take. That's the bottom line. Now, so the question then is, should you take CoQ10 if you're not on those medications? CoQ10, as I mentioned earlier, is one of the more expensive supplements, and I'm a fan of the test. Test, don't guess. So let's talk about how to determine CoQ10 levels. The determination of endogenous CoQ10 status is generally based on plasma measurements with an established reference range between 0.5 and 1.7. However, plasma CoQ10 status is influenced by both diet and your cholesterol levels, your lipoprotein levels. 25% coming from your diet. So if you ate a meal rich in CoQ10 yesterday, you might get plasma levels that are artificial, not artificially, but show up normal looking today. But if that diet wasn't consistent of what you typically eat, it's not going to be a great indicator for your long-term status. And so that's pretty much what they're saying here. You say, in view of the above limitations, the assessment of blood mononuclear CoQ10 status has been suggested as an alternative surrogate to determine endogenous CoQ10 levels in patients. The level of CoQ10 in mononuclear has been reported to correlate with the total amount of that, which is also in skeletal muscles, providing further support for the use of MNC as an appropriate surrogate to determine endogenous CoQ10. Well, what is an MNC? You've heard me say this a lot of times. You've heard me say white blood cell analysis, intracellular analysis, INA, white blood cells. That's what a mononuclear cell is. It's a type of white blood cell, and they're looking or measuring the CoQ10 inside of it. And so they're saying this could be a better way because it reflects more accurately the levels in muscle tissue. And so this is especially true if you have muscle pain or myalgia. But I'm a big fan of INA, intracellular nutrient analysis testing, because what you got to remember, CoQ10 works in the cell. Specifically, it works in the membrane of the mitochondria, where it performs a lot of its functionality. And if you're measuring it in the blood, you don't know whether it made it from the blood into the cell. You're just measuring quantitatively how much is in the blood. But if you can measure what's actually in the cell, you get a more accurate representation of whether or not what you're eating is making it where it needs to make it so that it can function and perform its job. So intracellular analysis is my favorite way to look at it. You can ask your doctor to measure it in your plasma. Again, the reference range 0.5 to 1.7. But it may be misleading. You can get false negatives on plasma readings more frequently. So I'll just caution you about the potential for that to occur. So that being said, I recommend INA testing. If your doctor doesn't know what INA testing is, you can visit us at glutenfreesociety.org and you can check it out. We offer INA testing there for people whose doctors will refuse to work with them. So that's just a resource that you can have to get your CoQ10 levels checked and measured. Okay, that does it for CoQ10. If you learned something new tonight, let me know. Chime in down below. Leave me a comment. If you've taken CoQ10 and you found it to be very helpful or improve your energy or improve your situation, share your story below. Your comment might help somebody else who's trying to justify whether or not to take CoQ10. Now, we'll say one other thing about it. As we mentioned before, CoQ10 is an expensive nutrient. You have to definitely make sure that you trust the company you're buying it from. A lot of CoQ10 on the market today is actually spiked with riboflavin, also known as vitamin B2. Now, there's a difference. So this CoQ10 is expensive. Riboflavin is not. It's very cheap, and so it's a great way for supplement manufacturers who are out to rob you or to be deceitful. The key is they're both very bright yellow. They both come out, when you look at the capsule, it's very, very bright yellow. It's very similar looking, and this is why this is commonly used in CoQ10 preparations, and this is a trick of the manufacturing industry. So you need to trust the company that you buy CoQ10 from. If you're just buying from some rando company, fly-by-night nutritional company, good luck to you. This is one of those you're not going to get a deal on CoQ10. There are a lot of times you can get a deal on different supplements, but CoQ10, the ubiquinol particularly, is patented. It's very, very expensive to make, and so that reflects in its cost when you're trying to buy it online. So if you find a CoQ10 supplement that's like 50% less than other CoQ10 supplements, and you think it's too good to be true, it probably is. It's probably just spiked with riboflavin, and you're probably getting ripped off. So just keep that in mind. You know, you don't want to take something that's not going to work for you either, especially those of you that are on medicines and you're trying to get your CoQ10 levels up. And if you're trying to judge whether your CoQ10 levels are coming up, make sure you wait about 3 months. So once you start supplementing, wait about 3 months, get a baseline level, get your doctor to test your baseline level, supplement, wait 3 months, and then come back and reevaluate your baseline level. Or reevaluate your new level. And if your new level isn't higher than your baseline level, you're probably taking riboflavin and not CoQ10. So anyway, don't get tricked by the charlatans that are out there that are trying to make a buck off of you. That would be bad. Okay, thanks for tuning in. Hope you learned something new. Make sure you join me on Thursday for a live Q&A. So if you've got questions about CoQ10 you'd like to ask me, we'll be here at 12:30 Central Standard Time this coming up Thursday. Take care. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.